So this is why I say that this whole plan, this global nursing migration isn't going to work, because this is what's happening in the Philippines. 2023, last year, Stop the Bleeding, Philippines health official says about international recruiting of nurses. So, this is a long article, but basically they have the West, well, they have I think Canada, but the West in general, always coming in and taking their nurses, and their nurses don't get paid a lot there. So anything America or the West would give them is always more. So it is attractive for Filipino nurses, but they are short 350,000 nurses. Great job, Global Health Plan. Yeah, you guys are just doing a great job of just letting the Philippines health system crack, because that's what's happening. They don't have enough people. And so people that are just pregnancies that are live far away from a hospital, they can't get to because they don't have the manpower. Because they said in this article, like, this is how much because really Canada or the US doing this, they still can get Filipinos cheaper than paying Americans. This is so simple to be fixed. It really could be. End the United Nations, period. Then there is no International Nurse Council anymore, because these people do not know how to do the right thing. Global health is not a good idea. It's not. You can't try to handle. You need to let hospitals be independent again, nurses be independent, stop being under this global health plan that's all politically motivated and is based on a sickness of people that are running it, and it is hurting health. It is hurting hospitals. It is hurting countries. So there's nothing good about a borderless world. And the Philippines have had this problem. They just usually don't say anything. But now their health ministries are speaking up about it, because they said the Western countries are getting more aggressive about taking their workers. Yeah, way to go, American Nurses Association. Like, just why would you want to be on board? Why wouldn't you, if you're an American or a Canadian Nursing Association, why wouldn't you want to promote, no, we want to hire our country's nurses? Not that we can't have nurses from other countries, but they're deliberately not hiring American nurses. And I would say the same thing going on in Canada, not hiring Canadian nurses, because they want to get what they will, which to Filipinos will be paying them more than what their country would, but is still less than giving to their own nurses. That's just a disgrace. It shows that you don't know how to be about good outcomes, because you're just about money. So there was government officials, hospital administrators, and nursing advocates in the Philippines are trying to find ways to make their own healthcare system sustainable, even as recruitment delegations, including from Canada and others, come knocking. The Manitoba government said it offered letters of intent to nearly 190 registered nurses, 50 people who are equivalent of licensed practical nurses, and 110 healthcare aides. Yeah, so see, all these countries, Canada, America, has to say, no, there's a shortage, nobody wants to work here. All the nurses are burnt out. But the same time that American Nurses Association was saying that about American nurses, it was happening in other countries too. Yeah, they were getting burned out too. So it just seems that they just want nobody in their countries working. None of their plans make sense. They make no sense. And even the president of the Philippines Nurses Association said this is a huge problem now. And the country feels like they should get some sort of compensation or something if you're going to come in and take all their nurses. Yeah, Manitoba's Minister of Labor and Immigration, John Reyes, said the province needs to fill nearly 2,000 nursing vacancies. And what kills me is that the CEO of the International Council of Nurses in Geneva, this is the one I bring up all the time, He actually made a statement here. This is how manipulative these people are, okay? Or else they're just so, like, they have to be so misguided. But he makes this statement. It's the higher income, richer countries who are going on this global shopping trip to address shortages. No, it's you, International Council of Nurses. It's you. It's you, Howard Canton, CEO of International Council of Nurses. You're the ones that want global health. You're the ones that want to migrate nurses from all these countries. I mean, what a hypocrite you are. I get so mad about this because but this is what this side does. They are always hypocrites. They always can't even see how they are the problem. Yeah, Howard Canton, CEO of the International Council of Nurses in Geneva. He went on to say, they are taking from the shelves, which are already very, very bare, and can least afford to lose nurses from. You need to absolutely assure yourself that you are not going to do more harm by recruiting from that country. Well, then you guys should stop, International Nurse Council. You should stop being on board with global health. You should realize that the best way to help health in the world is that each country should be sovereign. And really, you know what? If all countries put a stop to, and I guess you really couldn't, because then you'd be telling nurses what to do, but somehow mandate where it can only be a certain number, or just you force businesses to where, no, if you want to have a hospital, you're going to have to hire American workers. You can't play this, let's migrate cheap labor in anymore. He said, you need to absolutely assure yourself that you are not going to do more harm by recruiting from another country. Yet these are the same damn people pushing global nursing migration. The same organization. And I guess this CEO for an International Council of Nurses, he was having meetings in Bangkok with organizations from 9 countries representing nearly 10 million nurses, said they are all concerned about international recruiting and shortages. Okay, well then why don't you realize you guys are the problem? Oh, that will never happen, right? Because you're the experts. So, yeah, this is all just hurting. It's hurting every country because the people that came up, that decided to get on board with global health and this political agenda, while they want to claim they care about the nursing shortages, they're the ones that brought in all this system. Yeah. They're the ones that are pushing things that are not based on evidence. They're the ones that are pushing that you're no longer an American citizen, but you're a global citizen. It's them and the hospitals that have all merged together. They have created this crisis. And it will come back to their poor decision making will come back to haunt them, because someday they will be forced to see the truth of their own disastrous policies that they made the world get on board with.